Hello, everybody, and welcome back to Pressure BioSciences channel. We have a special two-way interview for you guys today as we sit here once again with Director of Sales and Marketing, John Hollister, and special guest, George Ackerson, the CEO and founder of Safer Medical of Montana. John, how are you doing today?
Hey, Mike, I'm doing great. I hope you're doing well there too.
I'm doing pretty well. And George, how are you doing?
It's always a great day in Montana.
Wonderful, wonderful. So, George, first and foremost, tell me a bit about Safer Medical of Montana, how this came to be and why.
Well, originally it was founded back in about 2000 as Safer Medical Inc., as a Delaware C corporation. Long story short, ultimately, I'm back here in Montana, and we had some things that came up. We reincorporated here and went ahead from that point forward. So we actually, Safer Medical has been around since the year 2000. And then we originally came out with this probiotic that is quite remarkable. It's an all soil-based organism with humic and fulvic structure, and arguably it is without precedent, literally on a global basis. And though we're not a big company, we're positioned now that we got better logistics to grow. And Safer Medical, as it was, came out because a lot of medicine in my mind's eye isn't really that safe. And I was thinking of something along the lines of being safer. Quite frankly, I got involved in the let's say called quality of life field as really a 2-year-old child who came down with polio. The long story short was my mother was an RN. On my second birthday, I literally fell into my cake face first, and that was not a good sign. And turned out that my neighbor was a medical doctor, next door neighbor, and worked with my mom. He was also a scientist. And here again, going fast forward, he had developed a treatment, of course not approved, for polio. And for a better part of a year, wearing a leg brace because my foot on my left side pointed to the 9 o'clock position. It was that bad. And I would get shots almost every day. And I mean, it hurt terrible. And relevant to what John knows, it's called osmotic pressure. They didn't lead any of this with Procaine or anything. So it was extremely painful. But literally from that point forward, as I grew up, of course, with my mother as a nurse, my uncle on my father's side was a medical doctor. I always had an interest in this field. My oldest sister went to Rochester School of Nursing, and ultimately around 1989, I became more involved in the area of, let's call it integrative / holistic medicine. So it took me to where we are today. It's been a really interesting ride. And I think that things like this don't happen by accident. In my book of life, there's no coincidence when you're really focused. And one thing leading to another, I found the program that Pressure BioSciences had. And I've had previous involvement with some products that are a nano emulsion for brain chemistry that was developed by a mentor of mine in 1996. And we had a brain chemistry product with some 26 ingredients to balance brain chemistry at that time. So I've learned a lot through, let's call it osmosis, rubbing elbows with a lot of bright people like John. I get on the phone with him, and it's like another education, because I'm not a biological chemist or botanist or any of that. I'm just an ex-military test pilot. I flew attack helicopters after Vietnam, where I was a scout helicopter pilot. And I got myself involved in some pretty interesting things over there that I'm very thankful that I got out of there alive with. But so I've had a lot of fun in my life. And quite frankly, and I mean this in all sincerity, meeting John and these people, because they have a different kind of energy than a lot of people present with. And so they're very curious, and they're very much seekers in life rather than sitting back and being satisfied. And that kind of excites me.
Yeah. George, first and foremost, thank you for your service And I will say I've talked to John and Rick pretty extensively, and you seem to fit in right with them, though, in terms of being a seeker and full of energy yourself. So I want to kick it to John now. John, from your perspective, what drew you then to George?
Hey, Mike, thanks. Well, as we've spoken, we're so excited about the UST platform, the ultra shear technology platform of making nano emulsions. And George reached out to us last year when we had our press release, our first press release about UST. And he saw the potential immediately. And then we heard his story, as you just heard, just the tip of his iceberg of this. But he is so committed to helping the veterans. And so we started working with him and developing some formulations on a CBD containing product intended to help a lot of the veterans that he knows personally and or has met through other people and their stories. So it's such a compelling story. And so we've come up with some formulations, and we've gotten to a stage where he was pushing us real hard to see if we could take the jump. And so he's one of the examples of this early access program that we've spoken about that we need to move forward to help get to the pilot stage where we can produce a larger volume of products so that he can put them out into the market and begin to learn about how to adapt it for his customers. But very exciting. His story is really, really compelling, but his audience is also tremendously compelling.
Yeah, fair enough. I mean, George, there's hardly a more noble goal than what you have sorted out here today. And it makes sense you'd be a part of this early program. So, John, I guess when can people expect to hear more about this? Is there a timeline, or should people just stay tuned as we go along here?
No, we're working to try to get his product out in the next couple of months at worst. And, the first stage is to lock in the formulation, which we've done a lot of work so far. We've had a lot of really important developments to make a better product. And then we're working with his bottling firm to set up bottling time and lines, and then he's going to work on putting it out in the marketplace through some really interesting channels. He has some great contacts in the market and that reach out to the veterans in different ways, which I think are going to be really exciting and fun to watch it unfold.
Yeah, fair enough. And George, I guess now that the ball is rolling, what are you most excited about coming up here?
Well, actually, we're having a meeting in Las Vegas, and a young man that I met through one of my physicians, who was a clinical trial physician out of Texas, this young Marine, actually, force recon sniper, who's just turning 34. And he is the ultimate badass, but a great guy, wealthy family, real intelligent. And he was dating this doctor that I've known for over 20 years, who's an OBGYN surgeon. And a lot of what we do has a more significant effect with our probiotic and some things where women are concerned. Mm-hmm. And so he told me about this gentleman, Paul Peters. I've called him and we've had a lot of discussions, and I'm looking for a webmaster. He said, look, I've got this girl's a friend of mine. She's about in her 30s near New Braunfels, and she's like a really, really good webmaster. So it's kind of teams coming together. And Paul's going to be flying up to meet with us in Las Vegas, and we hope to get him on board because he's hugely connected within the special operations community. And that's kind of our theme. Not that we're any special or more than anybody else, but there's a whole, as you'll see as our programs go along, there's a kind of a whole background here, how you weave this together. And then I've been privileged to get to know our governor. I go to it's kind of funny. He's an interesting guy, Governor Giamforte, but I go to their dinners and stuff, and he's a very wealthy guy, and they have their own foundation. He's really a go-getter. And so I've talked about some of this, and he's friends with Steve Daines, who I've met. He's our senator, and he's big on veterans. And I've also met on a number of occasions with John Tester, who's our Democratic senator from my county, and he knows me. And he also is the chairman of the Veterans Affairs Committee. Mm-hmm. And so we have a really good opportunity to get some of this into, let's say, the beginnings of the VA system, because they're looking for things that are less drugs have many benefits. The problems are people sometimes, well, one feels good, two is going to be better. And I mean, that's just how many of us think, myself included. I'm not into pills. I shouldn't be laughing, but it's kind of funny how things happen. So we're going to be communicating with them. They already know what's coming down the pipe, and I really believe we have something here that will be significant, because I've been working with some of, we had a limited production run, and I've worked with this as far as using it in a nebulizer at a 1 milliliter with a milliliter of saline, this little handheld device with batteries. And I've had personal friends that were really sick with COVID, caught it early, and they had difficult breathing. Actually, the young lady had to go to the emergency room. She almost died on the way. She wasn't getting enough oxygen. And I mean, it's scary. She's like in her late 30s. So this worked to help alleviate inflammation. And that's a very big part of what CBD does. And then there's applications throughout. I mean, we can also do it intraorally, and it crosses the blood-brain barrier. I mean, the things I've seen with this, other than, a lot of CBDs really are also ran. And that's what it has totally impressed me with Pressure BioSciences, is they, as we would say, they leave no stone unturned to get to the science and really develop to the maximum potential what they have. And from everything I've seen here, again, there's not a competing product out there, and we can bring it out at a very, very fair price.
Yeah, it is really interesting. I've read a lot about CBD, and there's been tons of studies showing its benefits. But as John, you and I have discussed about the UltraShear technology, it just seems like it's going to be able to bring out that much more bioavailability and make it that much more effective. So I'm really excited to see what you guys can accomplish here. It sounds like there's a lot of dominoes lined up, ready to be knocked over, and everybody stay tuned, because we'll let you know how things go along the way. John, is there anything else you want to add before we go today?
No, I'm so glad that George got an opportunity to share the enthusiasm and really this incredible story that we know, but we're really excited about sharing it with the rest of the world and helping the veterans, which at the end of the day is a story that we all understand. It's so compelling in this crazy world that we live in.
Wonderful. Well, George, thank you so much for coming on. It was wonderful meeting you, and I would love to chat with you again soon. And John, a pleasure as always. Thank you, everybody, for watching. If you guys have any questions for George, John, Rick, anybody, let us know. We'll happily dive into it further, and stay tuned for more content coming soon. But for now, gentlemen, have a wonderful day.
Thanks, Mike.
Thank you.